You're watching CTOM TV. Knowledge is power.
Which brings us back to Canadian healthcare and U.S. healthcare and kind of what's possible versus what is typically offered. And something that I talk with people a lot about is that there really are two reasons. If you were to say to me or Alex or anyone out there, why doesn't everybody know this, or why isn't this the standard of care? If all the oncology journals are saying that this approach to treatment is so much more effective and extending people's lives and reducing their treatment-related side effects, why isn't this just happening now? Well, there are two very good reasons for that unfortunately have nothing to do with you but will affect you. And one of those is what I call the information bottleneck. There's just so much information coming out every month. Alex and his team are challenged to keep up with it, and that's their job. That's all they do. An oncologist who's also, seeing between 60 to 100 patients a week and has about 2 hours a week for continuing education, they're not going to be able to get through more than a handful of papers, if that. Certainly not the hundreds that are coming out every month. So that's one of the reasons why. There's just so much information. No one person can keep up with it as it pertains to all different types of cancer, and so we need to appreciate that. And then there's also, frankly, just the bureaucratic element. In a public healthcare system, there's only so many dollars in the basket, and those dollars have to be spread out to every possible health concern, some prevention, but mostly response to treatment and then emergency care across the country. On top of that, every province individually has the right to determine which treatments they offer and which treatments they don't. And there's all sorts of reasons why they may or may not choose to offer an FDA-approved, highly effective treatment for the mutations that are driving your cancer when the province right next door will offer it. So there's just so much variation province to province. And again, there's the very real limitation of dollars and just how much money there is to spend. Typically, these new treatments are a little more expensive than standard chemotherapy, so that is a legitimate concern. And even as Alex was talking about his ideal imaging approach for people, let's say the PET-CT, not the PET-MRI, although I know that's what you prefer, even when it comes to PET-CT, those scanning machines are pretty expensive. And there are numerous provinces across Canada that have private PET-CT clinics, but there are other provinces that don't allow that and don't have PET-CT as an option for cancer diagnosis. And certainly, in Canada, PET-CT is not used as a first-line imaging diagnostic tool, or even a second or a third, actually. No. In the United States, however, for all you might want to say about the non-public healthcare element that they have, they're pretty innovative, and they move a little more rapidly into adopting technologies like genetic testing and PET-CT. It's very common for a person from the United States to give us a call or begin to work with us, and they will already have had a genetic testing panel, and they will already have had a PET-CT, because while they're not guaranteed to be offered to you as a U.S. citizen, many oncologists are well aware of their value, and many insurance companies cover those tests. So that's wonderful. It's one of the pluses of the United States system for sure. Another contrast there, in the United States, there are thousands of PET-CT machines across the United States. In Canada, we have 40. Yeah,
it's more than we had a few years ago.
This is true.
It's a start.
True. But it's important. The point I'm trying to make there, aside from there's some good stuff about US and what they're doing in terms of being early adopters, or kind of being more able independently as oncologists and as hospitals to absorb the new science, because they're not beholden to some federal or provincial body once something is approved. But really, where you live makes a difference to the treatments that you're going to be offered. And not because the treatments that are out there aren't better than what you're being offered, but because, as Alex was saying earlier, it's just not an option that your oncologist is allowed to offer to you, or perhaps may not even know about because of that information bottleneck. So what's most important is that all cancer patients understand that while the oncologist is a specialist in cancer, that is not the same thing as they know everything. It's not the same thing as they know all of the options that are available to you. And it's really important that you get those proper tests done right up front so that your first line of treatment is the one that's going to be most effective for you.
Thank you for watching CTOM TV. Subscribe below and stay informed.